Education Station. WTIM.
Good morning. Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust, where they put people first. I'm here on the phone with orthopedic surgeon for HSHS Good Shepherd, Dr. John Powell. Welcome to the program, Dr. Powell.
Thank you. Thanks for having me.
So you're here to tell us a little bit about arthritis. Let's start it off with the basics. What is arthritis?
Well, technically, arthritis means inflammation of a joint, but practically speaking, it essentially means loss of the cartilage that cushions the joint, the cartilage that covers the end of the bones where two bones meet. So when that cartilage is worn away, that's what we call arthritis.
What does arthritis typically feel like? Are there any warning signs?
Usually my patients describe a dull aching type pain, which usually isn't too bad in the morning when they first get up, but as the day goes on and they're on their feet for a longer period of time, the pain increases, gets worse. Typically they have to stop what they're doing, sit down or lay down for a while to get the pain to stop. A common story I hear is that, patients will say, well, we all went on vacation last week or last month, and everybody wanted to get up and walk the beach, or we had a walking tour, and I just told them to go ahead. It just hurt too much. I couldn't do it anymore. So it really limits their ability to be up and around on their feet. At nighttime, it's described usually as a throbbing type pain in the joint. But other symptoms include stiffness of the joint, especially when they first get up from sitting or laying down, and also swelling.
So it sounds like it's not something that is, it'll be there, but it worsens with activity. Is that fair to characterize?
Yes. When people complain of a joint pain in or around a joint that's not activity related, in other words, they might say it hurts more at night than during the day, then that's not a typical presentation for arthritis.
I see. So it sounds like there's a criteria for what arthritis is too. How would you describe that criteria?
Yeah, there's basically three different types of arthritis. The most common by far is what we call degenerative arthritis, which is essentially just kind of a wear and tear phenomenon, cumulative over time. I tell patients it's similar to just wearing the tread off of a tire. Other types of arthritis would include inflammatory arthritis, which we see in people who have rheumatoid disease, rheumatoid arthritis, or inflammation in a joint caused by gout, or inflammation in a joint caused by an infection. And then a more rare type would be what we call post-traumatic arthritis, which occurs when there's a fracture that extends into the joint surface. That can be something that happened, many years ago, or a fracture in the long bone, say in the shin bone or the thigh bone, that leads to deformity that then results in there being unusual stresses across the joint. So the degenerative arthritis, inflammatory arthritis, and then post-traumatic arthritis are by far the most common.
What causes arthritis?
Well, the causes would be what I mentioned above. The types of things that can contribute to arthritis are things such as excess weight, or doing exercises improperly, not modifying your activities to a proper level, things like that.
And again, this isn't something that happens overnight. This is, for example, having excessive weight for a long period of time, or exercising wrong for a long period of time. Just to kind of add to that point that you made.
Yeah, the degenerative type of arthritis is something that occurs over time. Now, the inflammatory arthritis, like I mentioned, gout or an infection, that can be a more acute presentation where you may go to bed feeling fine and wake up with a, with a warm, swollen joint that's very painful. But you're right, most of it is something that just deteriorates over time.
How can, well, let me restart here. When should someone seek medical advice, and who should they see if to get an accurate diagnosis to what's causing the joint arthritis?
Yes. Well, I mean, certainly it's reasonable to start with your primary care physician. You can't go wrong doing that. Obviously, I'm a little biased being an orthopedic surgeon, but I feel that we are, extremely qualified to determine the possible causes of arthritis. The way that we do that is by performing the proper X-rays in terms of getting the right views of a joint, determining whether further imaging such as a CAT scan or an MRI may be necessary. We can also order the proper blood tests to check for systemic conditions that may cause arthritis. We can perform what we call an aspiration of the joint, which means we remove fluid from the joint and send that off for a proper laboratory test to see if there may be something other than degenerative arthritis going on. And as I mentioned above, maybe gout or infection. So a lot of the kind of run-of-the-mill arthritis symptoms, as we've talked about, are sort of cumulative, and there will be no really red flag as to when you should go to the doctor. However, if I tell patients that if they are having pain that interferes with their sleep at night, that's kind of a warning sign that they probably should go see their doctor soon.
You mentioned one of the common stories you hear is how people go for a vacation with their family, they walk the beach or walk the town for long periods of time, and they just can't do it. What other type of situations have you heard as a doctor for arthritis?
So, for example, people, used to maybe walk the golf course when they played golf, and now they have to take a cart, or when they go do their shopping, they can't, walk through the store. They have to use one of the motorized carts, or excuse me, people who are employed doing heavy labor, have to retire at an earlier age just because they're no longer able to perform the work activities.
How does this impact overall quality of life?
It greatly impacts, your ability to get up and move around and to take care of yourself. If, you're an elderly person who still lives in your own home, but, you can't perform light yard work type activities or just everyday household activities, it can definitely affect your ability to stay independent in your home. And we see that quite a bit. And a lot of these people aren't really excited about getting their knee replaced or their hip replaced, but when you tell them, those types of things, that if you want to be able to stay independent and take care of yourself, and that you probably need to do something. A lot of studies have shown that throughout all the surgical specialties, that hip replacement surgery adds the most what is called quality of life years than nearly any other procedure throughout any other surgical specialty. So hip replacements really help add quality of life to patients.
In a way, once you have arthritis, it sounds like this vicious cycle where, man, I keep moving to keep myself active and going, but also I hurt, and therefore I hurt, so I don't want to do as much. I mean, how can patients break that cycle?
Yeah, that's a good question. I think overall it's better for their health to stay active. People frequently ask me, people I see in the office who maybe have arthritis of their knee, and they say, I like to walk a mile every morning or do that kind of thing. So any kind of low impact activity like that, the overall health benefits, outweigh any damage they're going to do to the joint. Now, sometimes we see people, sort of the diehard runners, who have to get their fix every morning and go out and run 5 or 10 miles, and then they wonder why their knee hurts. And so that's where the activity modification part of the equation kicks in, where they have to sort of help them understand that they may have some limitations on what they can do. But generally speaking, it's good to keep moving. Sometimes we'll send patients for some physical therapy for the therapist to help patients understand, proper body mechanics and how to move without putting undue stresses on their joints.
Let me reintroduce you. Got to take a break, come back, complete our conversation. That's orthopedic surgeon with HSHS Good Shepherd Hospital, Dr. John Powell, here on the WTIM Morning Show. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. Back after this short break.
WTIM.
It's time to play Trump or Consequences. Ready, Jill?
Let's go.
Thinking about Mary Miller and Rodney Davis in the race for Congress, who did President Donald Trump praise for fighting Joe Biden's, quote, runaway inflation?
Mary Miller, gotta be. Miller knows Biden is out of control.
Right, Jill. Next, who did Trump endorse for Congress?
Mary Miller. I know Trump backs Miller.
Correct. Miller has Trump's complete and total endorsement. Last question. Who is one of the very few Republicans in Congress to actually praise Joe Biden?
Who did that?
Rodney Davis.
So why would a Republican back Davis?
Good question. Because if you stand with Trump, Mary Miller is the right answer for Congress. Paid for by Club for Growth Action, clubforgrowthaction.org, and not authorized by any candidate or candidates committee. Club for Growth Action is responsible for the content of this advertisement.
For over 100 years, Kemmer Village in Assumption, Illinois, has been supporting children and families in need. They've been able to provide residential treatment and foster care services, an on-ground school, equestrian therapy, recreation therapy, and a great summer camp because of the generosity of caring people across Illinois. Your investment can be as rewarding to you as it is to the children. Go to www.kemmervillage.org/donate and help make a difference in a child's life.
If you're looking for local hunting and fishing information, then join us for Central Illinois Outdoors with me, Jared White, Saturdays at 10 a.m. here on WTIM. Every weekend, we'll offer detailed local fishing reports from professional guides. We'll swap stories with local celebrity sportsmen, and I'll invite you to share your stories as well. Central Illinois Outdoors with Jared White, every Saturday morning at 10 on all WTIM platforms. And on demand at centralillinoisoutdoors.com. Brought to you by Bob Ridings in Pana and the Clinton, Illinois Chamber of Commerce and Tourism Bureau.
Local, local, local. For 26 years, Just Beds has been your local mattress store for 26 years, featuring locally made Bemco mattresses like Arctic Breeze and Max Life. That's a lot of local helping local. And all this month at Just Beds, you'll save big on Bemco. Twin mattresses for just $149. Queen mattresses just $229. As always, free delivery, setup, and haul away. Locally. Thank you for supporting Just Beds for 26 years. Keep buying local, friends. See the Young Exterminators at Just Beds on Montvale and Springfield.
Just Beds.
This is Megan Lopez with Nesty's Burger Joint on the south side of the Taylorville Square. To see our menu, click on our icon on TaylorvilleDailyNews.com.
This is Shalis Nagel, Executive Director at Kemmer Village in Assumption. To learn more about our services, click on our icon at TaylorvilleDailyNews.com.
Your information station, WTIM.
Welcome back to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. I'm on the phone here with orthopedic surgeon for HSHS Good Shepherd Hospital, Dr. John Powell, talking about arthritis. You know, Dr. Powell, you mentioned it a little bit before we went to break about how anybody with arthritis can relieve some of that pain. You mentioned hip replacement surgery, but I understand not everybody is in that stage where they need hip replacement surgery. So what are some of the ways that people can relieve that arthritic pain?
Yeah, actually, surgery is always our last resort. I think we're all obliged to, excuse me, try something other than surgery first. So some of these I've already mentioned, but I'll go over them again. Weight loss is very important for pain control. Proper type and amount of exercise, and that's again where we sometimes will have the patients visit with a physical therapist. Activity modification, as I mentioned above, in terms of the runners and high impact activities. Actually, the diet patient's diet can impact their symptoms. Eating what's called an anti-inflammatory diet that avoids things such as bleached flour or sugar, processed foods, saturated fats can really surprisingly provide a lot of pain relief. Use of over-the-counter anti-inflammatory medications such as Advil or Aleve are helpful. Nutritional supplements, the use of glucosamine, chondroitin sulfate. Really, there's no hard evidence that shows that works. There's a lot of anecdotal evidence where patients will feel like it helps them. So I do offer that to them. It's a non-prescription medication that you can get at the drugstore. We also use joint injections, either steroids or what's called viscosupplementation, which is sort of a joint lubricant. And then we get in what's called biologics, which is use of platelet-rich plasma or stem cells, although, as mentioned above with the other alternatives, there's no real hard scientific evidence that shows that that's efficacious. But we kind of have a lot of different tools in our belt that we try initially before we offer a patient surgery.
Do the treatments for arthritic pain vary based on the root cause of the condition?
Definitely, yes. So, for example, if it's an inflammatory arthritis, then we're more likely to treat that with medication such as steroids or the non-steroidal anti-inflammatory medication, although the non-steroidals do help with degenerative arthritis. If somebody has arthritis resulting from gout, then there are specific medications that we use for that. And then sort of at the extreme is if the arthritis is the result of an infection, then that actually requires emergent surgical treatment.
When you don't have arthritis, what can you do right now to prevent the onset?
Yes, well, I'm going to sound a little bit like a broken record here. I'm sorry.
No, hammer it home.
Maintaining a proper weight for your body frame is probably the best thing you can do for yourself in terms of preventing the development of arthritis. When you put your foot up on a step to climb a step, the pressure between the two bones is 10 to 12 times your body weight. So even losing 20 pounds takes 200 pounds of pressure off that joint when you climb stairs. So weight control, proper exercise, maintaining good core strength so you don't stress your joints too much. Things like yoga or balance exercises are really helpful. Proper activity level, maintaining, keeping in motion but not overdoing it. Proper diet, as I mentioned above, and then just getting regular checkups with your primary care doctor and make sure there's nothing else going on. I think those are the most important things that you could do to prevent the development of arthritis.
What's your number one message to anybody? Because we're all susceptible to arthritis. So what's your number one message to preventing or managing arthritis?
Well, the prevention I just discussed in terms of management, I think that you could, for example, if you start having some aches and pains, think about activities that maybe bring the pain on and try to avoid those. Maybe change your workout routine, for example, or what you're doing for exercise. Trying some over-the-counter anti-inflammatory medication on your own is fine. But if it's getting to the point that you can't do what you want to do, I think it's worthwhile going and seeing your doctor and see if they can keep you on your same activity level.
That's HSHS Medical Group Orthopedic Surgeon Dr. John Powell. Thank you so much, Dr. Powell.
Thank you. It's been a pleasure.
The Big 870 WTIM Assumption Taylorville, 96.1.